Dear students and my teacher friends, Namaskar. I welcome you to the presentation lecture on Tetany. So today's our topic of discussion is Tetany. What is Tetany? How Tetany is caused, and what happens in Tetany? How the patient is affected by Tetany. So Tetany, see definition. This is the definition of Tetany. So tetany is actually a condition marked by intermittent muscular spasm, and this muscular spasm caused by malfunction of parathyroid gland and consequent deficiency of calcium. So from this definition we can make out that in tetany patient what is happening, that parathyroid glands are not working properly. They are not producing the hormone, they are not secreting the hormone properly, and there is a deficiency of calcium. So due to that, muscular spasm is occurring. So what is the muscular spasm, that we are also going to discuss now. Here you can see parathyroid gland disorder. So there are two parathyroid gland. We can classify parathyroid gland disorder into two category. One category is hypoparathyroidism, and the second category is hyperparathyroidism. So here we are discussing the hypoparathyroidism. Now, what is hypoparathyroidism? Hypoparathyroidism literally meaning too little parathyroid hormone. So there is very less amount of parathyroid gland hormone are secreted, and as less amount of parathyroid hormone are secreted, this leads to deficiency of blood calcium. So when parathyroid gland are not working properly, they are not producing the sufficient amount of hormone. So that time in the blood the calcium level decreases, calcium level goes down in the blood. Now as there is a deficiency of calcium in the blood, this will cause the neurons and muscle fiber to depolarize. So due to the deficiency of blood calcium, neuron and muscle fiber, they depolarize and they produce action potential spontaneously. So very quickly, very rapidly, the action potential or the nerve impulse is generated. Now this depolarization and action potential of neuron and muscle fiber, this leads to twitches. Okay, so this leads to twitches, spasm and tetany of skeletal muscle. So now what is twitches? So see, twitch means to make a quick sudden movement, often one that you cannot control, to cause something to make a sudden movement. These are the meaning of twitch. And if you can understand the Hindi language, so here some meaning in Hindi for twitch are given. So this was about the twitch. Then spasm. Okay, spasm. So what is spasm? Okay, over here, spasm. Spasm means a sudden movement of muscle that you cannot control, that is known as spasm. Okay, and here in the Hindi language also they have given the meaning of spasm, if you can understand Hindi. So now again we are continuing our discussion on tetany. So we have seen that parathyroid gland, when it is producing too little parathyroid hormone. This leads to deficiency of calcium, and a deficiency of calcium in the blood will cause neuron and muscle fiber to depolarize. They will generate spontaneous action potential. This will lead twitches, spasm, and tetany of skeletal muscle. Now, what is tetany? So tetany means maintain contraction of skeletal muscle. So continuously skeletal muscles are contracting in tetany. Okay, so how the what are the causes of tetany? Why tetany is occurring in the patient? So one reason we are remembering hypothyroidism. Second reason, too little parathyroid hormones are secreted. Third reason, deficiency of blood calcium. Fourth reason, depolarization of neuron and muscle fiber, and spontaneous action potential can be the fifth reason for the tetany. Now, now the leading cause of hypothyroidism. Why hypothyroidism is occurring? So, accidental damage to parathyroid gland. If parathyroid gland is damaged by accident, so due to that, parathyroid gland is producing and secreting less amount of parathyroid hormone. And second reason is thyroidectomy surgery. That means by operation, by surgery, if the thyroid gland is removed, that time the blood is not supplied to parathyroid gland, and if the blood is not supplied to parathyroid gland, they are not able to produce and secrete the parathyroid hormone properly. So that is also the reason for hypoparathyroidism. Now we are moving forward, and over here, see, hypocalcemic tetany. So what is hypocalcemic tetany? So tetany is the involuntary tetanic contraction of skeletal muscle that occur when the extracellular calcium concentration decreases to about 40% of its normal value. So the reason why the tetany is occurring in the patient is that involuntary tetanic contraction of skeletal muscle. So skeletal muscle are contracting and the patient is not having control on his muscle. So that means they are continuously there is a movement in the skeletal muscle, and patient is unable to control his muscle. That is what exactly happens in the tetany. Now the reason the tetany is occurring is that the extracellular calcium concentration is decreasing to about 40% of its normal value. Now this seems to be very surprising, because we have seen that calcium is required in the muscle contraction topic. We have learned that the calcium is important. Calcium is playing a very vital role, very important role in muscle contraction process, and we have already studied the excitation contraction coupling. So now you are familiar that what role the calcium is playing. However, recall means, if you remember that this calcium is the sarcoplasmic reticulum. So in the muscle contraction process, we have seen that the sarcoplasmic reticulum is playing an important role, and here in the muscle contraction, it is not the extracellular calcium. So when the level of extracellular calcium is decreasing, so this is going to exert the effect not on the sarcoplasmic reticulum calcium, but directly on the plasma membrane. That means, once again, so if the level of extracellular calcium is going to decrease, this is not going to affect the sarcoplasmic reticulum calcium level, but the extracellular calcium is decreasing. That means this thing is going to affect directly on the plasma membrane. Now, this low extracellular calcium, this condition is known as hypocalcemia, and if extracellular calcium level is down, so this will increase the uh, opening of Na plus channel. More and more Na plus channels are going to remain open in excitable membrane, and as more and more Na plus channels are going to remain open, this will lead to membrane depolarization, and there is a spontaneous firing of action potential. That means the nerve impulse is continuously and very quickly generated, and as the membrane depolarize and spontaneous firing of action potential, this is going to increase the muscle contraction of the skeletal muscle, and these effects are similar to muscular cramping. Okay, so in short, what is happening in tetany, that the blood calcium level is decreasing, extracellular calcium level is decreasing, and this is going to affect such a way that the Na plus channels are remaining open. So this will lead the depolarization of membrane will occur, and the action potential spontaneously firing. Okay, and due to that, there is a involuntary contraction of skeletal muscle is happening in the skeletal muscle. This is what exactly happens in the tetany. So with this, we have completed our discussion on tetany. I hope you have enjoyed this lecture, and I also hope that this lecture will be helpful in your exam preparation and also in your studies. My name is Manish Koshti sir. I am from Ahmedabad, India. Bye bye. Namaste.